Nurse Debbie, I have a fibroid. Can I give birth to a child? Yes, you can, but depends on the location, depends on the size, and depends on the signs and symptoms you do see. So, good day, my friends and followers. Welcome to Nurse Debbie FTs that teaches you about your health with pidgin English. Please don't forget to subscribe on my YouTube channel. Don't forget to follow me up on my Facebook, on my TikTok. And please, if you are watching this video, make sure you share this video. Share this video. So I don't come again with another topic which I title fibroid. Many women always they suffer for this fibroid. And what be this fibroid? How you say they call? What they cause some? What be the signs and symptoms? How go take no say yes now fibroid they worry me. So first of all, let's know what is fibroid. So what be fibroid? Fibroid are that growth will be like orange shape where they grow for inside the uterus. Now that growth will be say they develop for inside your uterus or inside your womb where baby they stay. So and normally our womb gets this guava shape. It get this guava shape. So once fibroid already there, the thing they expand to orange shape. So now say go they big they go. So what did they cause this fibroid? I will just let you know saying this fibroid causes is unknown. Nobody know what they cause this fibroid. But most women, the less they get this fibroid, if that estrogen they high, everybody gets estrogen. It depends if the estrogen high, that person gets high estrogen level. You understand me? For those who be say they don't run hormonal test before, now go understand which side they talk about this estrogen might they talk about. Now go understand that. So that's why it's good for you to run a test. Go and run hormonal test to see how many level all your hormone they whether they balance or not. So estrogen the is they cause or they likely to make person get this fibroid. You understand me? People will get fibroid make them not blame them. It's just that their estrogen level they high. That is the reason why we say they get that fibroid. So what will be the types of fibroid? One, we have submucosal fibroid. We have submucosal fibroid. This submucosal fibroid then they develop in the muscle area where the womb dey, where your uterus dey. So it develop for there. You can't develop, you can't go down to your pelvic region, which is your waist region. You can't go down to your cervix region. For those who be say they don't put hand for inside body, that's what they see for there. You can't develop come outside from there. So now be this submucosal fibroid. So number two, we have intramural fibroid. Intramural fibroid. This fibroid they grow for wholly inside the uterus, inside the womb. Now that fibroid they grow. So only inside the uterus. Now this intramural fibroid they grow. So the third one we have subserosal fibroid. Subserosal fibroid. This subserosal fibroid they grow outside the womb, outside the uterus. Now this fibroid they grow put I mean. So this subserosal fibroid they grow outside the womb. Like I said, first one is submucosal fibroid. Maybe say it they grow all over the muscle of the uterus, down to our pelvic region and down to our cervix. You understand? Then the second one is intramural fibroid, which is they grow for inside the womb, inside the uterus. Now that fibroid they grow. Then the last one is subserosal fibroid. We say it they grow outside the womb, outside the womb. So what will be the signs and symptoms of this fibroid? Yes, these signs and symptoms they're different. Like if I say they're different, like if Mr. A get fibroid or Mrs. A get fibroid, Mrs. B get fibroid, and the signs and symptoms go different from yours. You understand? Because it depends on the type of fibroid where you get. The type of fibroid get their own signs and symptoms. You understand? So And that size symptoms also gets location and the size, which if I say that, if I talk about this location, I'm talking about those signs, those type of fibroid. Maybe say I mentioned intramural and some mucosal fibroid and all. So it depends on the location. Now I go give you the signs and symptoms, and it depends on the size. Now you know the signs and symptoms. So what will be the signs and symptoms of this fibroid? So listen to these signs and symptoms. If you know so you dey experience this thing, make sure say you go visit the doctor, go hospital, go check yourself. If you dey experience these signs and symptoms. Number one signs and symptoms is painful menstruation, or you get cramping of the waist. You dey feel pain. Maybe you know dey feel pain before, you come dey see yourself dey feel pains. You dey feel pain. If you know say you dey see that kind thing, make sure say you go see the doctor or go to a laboratory office and run a pelvic scan. Okay, so that is number one. Number two is heavy bleeding. Like the bleeding, they mush, it dey thick. The way they come outside, you know like am, it dey thick. That is number two, heavy bleeding. Number three is prolonged bleeding. Maybe it's supposed to, your duration of bleeding now 5 or 6 days or 4 days or 2 days, then they rush you. But it can't prolong past that one. You can't reach 10 days, from there 11, 12, 13, 14, 15, and they see that bleeding, they go like that. If they see them, go see your doctor. It might likely be fibroid. So other one again, which is number 4, bleeding after sexual intercourse. That is number 4. Number 4 is bleeding after sexual intercourse. For women, maybe say they experience bleeding, maybe they don't make love finish, they see this bleeding after sexual intercourse. Make sure say you visit the hospital, or you run a test in a laboratory office, pelvic examination test. Run those tests. Make sure say you dey check your hormone. So number 5 signs and symptoms of fibroid, we have difficulty in getting pregnant. Wow, I believe saying now, if you say yes, can I get pregnant? Yes, you can get pregnant, but it depends on the size of the fibroid. One, and now go come lead to another symptoms, which is number 6, miscarriage. You understand? That difficulty in getting pregnant is depends on the location or the kind of fibroid you get, whether na submucosal fibroid or this intramural fibroid, all those kind of things. That type of fibroid, if you know see now those kind of type, maybe say I mention, now they make somebody know they get belle. So one of it, the least they difficult for someone to get belle. And if that be the case, say the size of the fibroid come big, and maybe you come later take him, and that fibroid big, the pikin of fit grow, because why? The fibroid big for there, so you come compress and come cause miscarriage. You understand me? So no pikin of fit grow big, because why? Fibroid dey there, so you come cause miscarriage, which is our number 6 of fibroid, of signs and symptoms of fibroid, which is miscarriage. So number 7 of signs and symptoms of fibroid is infertility. Number 7 is infertility. Now be signs and symptoms of fibroid. That infertility be say someone can't give birth, and it dey affect someone to give birth on time. You understand me? No, so once fibroid already they grow for that uterus or for that your womb, so those they cause infertility. They're difficult to get pregnant. So the last one, we have large abdomen, and this large abdomen, it will make belle dey big. Maybe say you see some people, their belle go dey big, or facing maybe na pikin dey inside, or if you know say they experience this big tummy, like your belle dey big, it can be fibroid. So now signs and symptoms of fibroid: big abdomen, painful menstruation. We have a painful menstruation. We have heavy bleeding. We have difficulty of getting pregnant. We have miscarriage. We have prolonged bleeding, we have bleeding after sexual intercourse. So if you know say they see all those signs of fibroid, make sure say you go see the doctor, visit the doctor. If na waiting they'll give you drugs for to shrink it, or if na waiting they go use surgery take comot am, make sure say you see your doctor. And for those wey be say that they expect for this, like, can I get pregnant? Yes, you can. It depends on where your location of fibroid is. You understand? Like I mentioned 3 type of fibroid and their location. I told you one of them is located outside the womb, while the second one is located in the muzzle layer of the womb. Then while the last one is located inside the womb. So it depends on the location. That is when we can tell you, or once you run a test, we'll know say yes, now this you fit get belle with this type of location. But note, don't it be say they grow outside the womb, like the the layer of the womb, like the muzzle layer, it can develop, come outside for your pelvic region and your cervix region, the belle con dey big dey go. It's dey difficult for someone to get pregnant. And if you just dey start to dey see that fibroid, whether e dey outside the womb, whether e dey the layer, whether e dey inside or not, and the fibroid still small, make sure say you dey take medication to shrink the fibroid. I believe say na dey wait for the drugs, but I'm not going to prescribe the drugs for you now. I'm not going to do that. But first thing I would like you to do is to run a test. If you told me you have a fibroid, if you come to my DM, you told me you have a fibroid, first now we ask you, have you run a test? If your test is above 2 months, I'm not going to answer you until you run a new test to know the size of the fibroid and to know where the fibroid is located. Not mind me, I don't want to English. So I believe saying I don't already understand. Yeah, if you see this video and you're first time to watch it, make sure say you share this video so that everybody needs to benefit about this fibroid. I still remain your nurse Debbie that teaches you about your health. Bye.